All right, welcome back, everybody, to the deep dive. We're diving headfirst into some really fascinating material you sent to us.
Yeah, this is some good stuff.
It is good stuff. It's really good stuff. Um, it really gets into this idea of, okay, well, so many people deal with, heartburn and reflux,
Yeah.
and kind of the standard solution is to, take some kind of antacid, omeprazole, or something like that.
Right.
But what are some of the alternatives?
Yeah.
Maybe not just long-term omeprazole or even surgery.
Yep.
And the material that you shared gets into um, some real interesting, I guess, insights into one person's work,
Right.
helping people actually get off of omeprazole,
Right.
and then a doctoral thesis that they wrote about manual therapy and GERD associated with hiatal hernias.
Yeah. Great stuff.
And so we really want to dive into
Yeah.
this idea of, is manual therapy really a viable option?
Yeah. Yeah, definitely. This should be interesting.
So these kinds of things. So
Yeah, it's a really interesting stuff to unpack here. We're going to look at, like you said, the potential downsides to long-term use of medication like omeprazole, what the surgical route looks like, and then how manual therapy might be that maybe less invasive alternative
yeah,
to those things.
and really give people a new perspective on managing reflux-related issues.
Oh, really?
So let's jump right in. Why don't
Yeah, let's do it.
Let's tackle omeprazole first. I mean, it's just become, so common. You go into any store, you can buy it over the counter.
Yeah.
But the material you shared really raised some concerns about long-term use.
Right. Yeah. And it's striking how widespread its use has become without necessarily full understanding of what those long-term effects might be. The sources you provided, they reference a number of scientific studies that have shown some pretty significant adverse effects linked with the prolonged intake of omeprazole.
Right. Yeah. And I think it's so important to highlight that it's not to say that it's inherently bad
Right. Of course.
or
Right.
it shouldn't be used,
Yeah.
but the long-term use, and maybe we'll get into that later, why that is
Right.
so widespread. But
Yeah.
yeah, and this was really fascinating. It's designed to reduce stomach acid, and I think most people know that. Like, that's the goal of it, right?
Yeah.
You take it, it reduces your stomach acid. It's supposed to help your reflux. But what I was so fascinated by is that in the long term, it could actually contribute to more reflux.
Yeah, that's right. It can seem kind of counterintuitive, right?
Yeah, it does.
Because you're like, well, I have too much acid. That's why I have reflux. So how does lowering it make it worse? But the way that omeprazole works, it's a proton pump inhibitor. So it really drastically reduces the hydrochloric acid in your stomach. So in the short term, that can help reduce symptoms. But in the long term, that reduction in acid can lead to hypochlorhydria, which is essentially low stomach acid. And low stomach acid, here's the kicker, can actually cause the lower esophageal sphincter, which is the valve at the top of your stomach that keeps everything down, to relax spontaneously.
To just kind of open up.
To just kind of open up.
When it shouldn't.
When it shouldn't, yeah, which is why you get more reflux.
Wow.
So.
Yeah, that's it. It does make sense when you explain it like that, but
Right.
it is so counterintuitive, right? It's like, why would less acid
Right.
lead to more reflux?
You'd think the opposite would happen.
Right.
But it's that long-term suppression of acid that really causes the problem down the road.
And the material also mentioned some other problems associated with that reduction in stomach acid.
Yeah, absolutely.
Just reflux.
Yeah, so think about it. Stomach acid, right? The reason we have it is not just to digest food. It's a really important barrier to all the nasty stuff we breathe in and eat every day.
Right.
So when you weaken that acid barrier with long-term omeprazole use, well, you become more susceptible to all those pathogens getting into your system. And on top of that, the source material, it was really interesting because it pointed to a strong connection between the long-term use of omeprazole and imbalances in the gut microbiome. Intestinal dysbiosis is the term. It also talked about SIBO, small intestinal bacterial overgrowth, and IMO, which is intestinal methanogen overgrowth. So it's like this cascade effect. You start taking it for one thing and it can lead to this and this and this and this.
And it seemed to suggest that it's almost like it's rare to find somebody who's on long-term omeprazole who doesn't have some form of gut imbalance.
Yeah, that's right.
So if that's the case, then why are we prescribing it so much? Why is it, available over the counter?
That's a really good question.
I mean, is there a gap in patient education, or are the short-term benefits outweighing the potential long-term risks?
It's probably a combination of factors, right? I mean, there's direct-to-consumer advertising. There's A lack of understanding, like you said, about the potential long-term effects. And there's also this idea that, well, it works right now,
Right.
so I'm going to take it. And I'm not going to think about what might happen later.
Yeah.
And to be fair, there are absolutely appropriate uses for omeprazole.
Right. Yeah. It's not to say that it shouldn't be used at all.
No, 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 absolutely not.
But, it seems like it's a question of,
Yeah.
when and for how long.
Right, exactly. I mean, it can be really crucial for managing some pretty serious issues. If you have significant esophageal erosions, esophagitis grades 1 through 3, it can also play a role in preventing the progression to Barrett's esophagus, which is a precancerous condition.
Right.
So in those cases, it can be a vital tool to stop that tissue damage from happening.
Yeah. So again, it's not that it's inherently bad, but it's a question of, in what context is it being used?
Exactly.
For how long is it being used?
Yep. And if you look at a lot of the packaging for omeprazole, even over the counter, a lot of times it says 14 days for symptom relief.
Yeah.
So, the problem is that long-term use, sometimes for years, without proper medical, justification or monitoring, can have these, potentially negative consequences.
And that's really where, the source material was sounding the alarm. It was like,
Okay.
hey, this long-term use that seems to have become
Yeah.
so widespread, maybe we need to take another look at this.
Yeah, I think that's a really valuable takeaway from all of this.
So, okay, so we've kind of explored the medication route and maybe some of the downsides of long-term antacid use.
Right.
Let's pivot to the surgical route for a second. And this is for, dealing with hiatal hernias, which are often the major contributor to reflux. And it seems like the material suggested that surgery is often considered kind of the next step
Right.
when medications just aren't cutting it anymore.
Yeah, that's right. And a hiatal hernia, for those who don't know, is where part of your stomach bulges up through an opening in your diaphragm.
Yeah.
And that can really drive reflux. So when medications like omeprazole aren't effective at controlling the symptoms, then surgery becomes the next logical step in a lot of cases.
Yeah, and what does that surgery typically look like? I mean, the source mentioned that surgeons, sometimes they can even be hesitant to perform this because of, the potential for the hernia to come back, right?
Yeah, that's a big concern. I mean, the surgery involves repairing that hernia, pulling the stomach back down into the abdominal cavity, tightening that opening in the diaphragm. But the problem is, and surgeons are well aware of this, it's not always a permanent fix. There's a chance that that hiatal hernia could recur, it could come back, and the reflux symptoms would return.
Yeah, and why is that? I mean, is it that the diaphragm is a muscle, it's constantly moving,
Yeah.
and so the repair can sometimes...
Yeah, it can weaken over time, it can stretch. And then, there's things like, increased abdominal pressure from, chronic coughing or straining that can also contribute to the recurrence. So it's not a surefire thing. And that's why surgeons really have to weigh, the benefits and the risks.
Right.
And it's usually reserved for situations where all other options have been exhausted.
Okay, so surgery, even though it might seem like a more definitive solution,
Right.
still not necessarily a permanent fix.
Right, exactly.
And that brings us to the really intriguing part of what you shared with us, which is this alternative approach of manual therapy.
Yeah. This is the exciting stuff.
Yeah, and this is where the doctoral thesis you sent
Yeah.
really gets into this.
Yeah.
So we're now talking about, using hands-on techniques to manage GERD.
That's right.
And we're talking about GERD, again, that's associated with hiatal hernias.
Right.
And it seems like this approach is really about addressing the physical mechanics
Right.
of the condition, like getting in there and trying to.
Yeah, instead of just masking the symptoms with medication or doing this invasive surgery, it's about saying, well, what's causing this on a mechanical level?
Right.
And can we address that?
Yeah.
And the thesis that you shared, it investigated the effectiveness of a specific manual therapy protocol that they implemented over a 5-year period.
Oh, wow, 5 years.
Yeah, that's a pretty good study.
Yeah, that's significant. Okay, so what kind of hands-on interventions are we talking about here?
So the protocol was centered around gentle hands-on techniques, right? They weren't, going in there and doing anything crazy. It was gentle, specific, and really aimed at the areas that were affected by the condition. So they would do things like a gentle repositioning of the stomach, kind of facilitating its descent back down below the diaphragm.
Yeah, so almost like a massage butt.
Yeah,
Yeah.
but very specific,
Very specific, yeah.
targeted, and it was really about improving the alignment of the gastroesophageal junction,
Right.
which is where the esophagus meets the stomach, in relation to the diaphragm. And the goal there was to really optimize that diaphragm's role in helping close that esophageal sphincter, which is what prevents the reflux. They also addressed other symptomatic areas like chest pain, throat issues like dysphonia, which is a voice problem, and dysphagia, which is difficulty swallowing.
So it was a combination of working on the root cause, I guess, the mechanical issue with the hiatal hernia, but also
Right.
helping to alleviate some of those.
Yeah, treating the whole person. It
Yeah.
wasn't just about fixing one thing, it was about helping them feel better overall.
And what were the results? Because, I think you mentioned earlier, sometimes people were seeing significant improvement in just the first or second session.
Yeah, it was pretty remarkable. I mean, the study found that the majority of participants, they experienced noticeable, meaningful improvement in their reflux symptoms after just the first session.
Yeah.
And that's key because it shows that there's this potential to really directly address the mechanics of the condition.
Yeah.
And not only that, but those improvements were generally maintained in the follow-up assessments, meaning it wasn't just a temporary fix.
It wasn't just a one-time, you feel better for a day or two and then
Right.
it goes back to where it was.
Exactly.
So this is huge.
It's promising. It's really promising.
Yeah.
Especially if you think about it in the context of, okay, you're having these reflux symptoms, you have hiatal hernia, maybe this is something you can try before you jump into surgery.
Right.
Or before you start taking medication long term.
Yeah, so it could be a first-line approach,
Right.
potentially.
Exactly.
And just to clarify, the mechanical aspect, you keep talking about the mechanical aspect,
Yeah.
that is the hiatal hernia. Right?
Yeah, that's the enlarged opening in the diaphragm
Right.
that allows the stomach to push up into the chest.
Because of the normal pressure changes when you breathe.
Exact.
So it's almost like it's a structural thing.
It is.
And the manual therapy is going in and trying to help that structure be.
Yeah, it's kind of like, realigning things,
Yeah.
getting everything back where it should be. And by doing that, you're improving that natural anti-reflux barrier. You're getting the body to work the way it's supposed to. It's pretty cool.
Yeah. And it seems like this is this manual approach, it's really addressing that underlying mechanical issue
Yeah.
in a much less invasive way.
Right.
I mean, compared to surgery.
Yeah, absolutely.
And the material even mentioned that, there was collaboration with digestive surgeons
Yeah.
and that there were even patients who were able to avoid surgery altogether.
Yeah, I mean that's really significant, right? That
Mhm.
these surgeons who are, trained to do surgery, they were open to working with these manual therapists and seeing that, hey, maybe we don't need to cut everyone open.
Right.
Maybe there's a less invasive way to address this. And the fact that they saw positive outcomes in patients who were initially being considered for surgery, that speaks volumes.
Sure.
For reflux disease and hiatal hernias, the manual therapy provided an alternative
Right.
that addressed similar issues but without the knife.
Yeah. And it really, you start to think, well, so often it's like the first line of defense is medication. Right. And then if that doesn't work, it's okay, well, we'll go in and we'll do the surgery.
Right.
But, it seems like there's this whole other approach that maybe we should be considering.
Yeah, that maybe should be explored earlier on.
Yeah.
Right. It doesn't have to be this last resort kind of thing.
Right. Exactly.
Yeah.
Okay. But, and this is important.
Yeah.
The material was also really clear about emphasizing that it's not just about the manual therapy, it's about a more holistic approach
Absolutely.
to managing these kinds of conditions, right?
Yeah, you can't just go in, get a treatment, and expect everything to be fixed forever.
Right, right.
It's a process. It's ongoing.
So even though manual therapy can be effective at addressing the mechanical components, you're saying that lifestyle still plays a role.
Huge role. And that's things like your posture, your physical activity levels, your work habits, even the state of your nervous system.
Right.
All these things can affect your reflux.
So it's not a one-time fix.
No, it's not usually a one-time fix.
It's about an ongoing process of management, right?
Yeah, it's about empowering people to take control of their health.
Yeah.
And really understanding how all these different factors can play a role.
And the source material was also talking about the importance of follow-up. of maintenance.
Right. It's like anything else. You got to maintain it. You can't just, go to the gym once and expect to be in shape forever.
Right, yeah.
You got to keep going back. And it's the same with this. You get the initial treatment, you feel better, but then you got to keep those good habits going.
And they mentioned these preventative sessions.
Yeah.
Is that kind of what you're talking about?
Yeah, exactly. It's about going back, maybe not as frequently, but regularly to make sure things are staying in alignment
Right.
to kind of head off any potential problems before they start.
Right. And it seems like, it's almost like a growing acceptance of using manual therapy for things beyond just, musculoskeletal problems.
Yeah, that's a really exciting trend, I think.
Oh,
For a long time, it was just like, oh, you have back pain, go see a manual therapist. But now we're starting to understand that it can have much broader applications,
yeah.
for digestive issues, for all sorts of things.
Wow, yeah. So to kind of bring it all together, we started with the material you sent in.
Yeah,
We learned about the potential downsides of long-term omeprazole.
right.
We talked about how surgery for hiatal hernias isn't always a perfect solution because of their recurrence.
Yeah.
But then there's this exciting, potentially, less invasive alternative with manual therapy.
That addresses the root cause of the problem.
Yeah, so listeners, this information, hopefully it gives you a broader understanding of what's out there, of the options that are available to you.
Yeah, and maybe a new perspective on how to approach managing these kinds of conditions.
Yeah, and it really has been a fascinating exploration, of the material that you sent to us. And it makes you wonder, when you consider the interplay between, the position of the stomach, the function of the diaphragm, the long-term use of antacids,
Right.
what other seemingly simple mechanical interventions might be out there?
Yeah. What else are we missing?
It's really something to think about.
Lots to explore.
Yeah. So thanks for joining us on the deep dive.
Yeah. Thanks for listening.
We'll see you next time.